Our second set of speakers are Dr. Cheryl Heykoop and Kat Dornian. Cheryl Heykoop is a health research BC scholar and associate professor at Royal Roads University. She leads the Anew Research Collaborative, which focuses on adolescent and young adult cancer care. She has 20 years of experience in participatory research and has lived experience of a cancer diagnosis herself as a young adult. And then Kat Dornian is a designer and learner dedicated to creating community-led experience for growth and change. Since their own cancer diagnosis in 2021, Kat has worked with the Anew Research Collaborative to create the immersive experience that premiered at the 2024 BC Cancer. Sounds exciting. Please take it away.
Thank you so much for the introduction and wonderful to hear about the presentation prior to. So thank you for sharing, Chelsea, Chelsea and Gloria. So as Ross just mentioned, my name's Cheryl, and I'm joining today from the traditional lands of the Lekwungen speaking peoples, specifically the Songhees and Esquimalt nations here in Victoria. And then Kat is elsewhere. So I'll pass it over to you, Kat, to introduce where you're joining from today.
Yeah, I'm joining from Calgary, Alberta, which is on Treaty 7 land, which is the traditional territory of peoples of the Blackfoot Confederacy, Eyahe Nakota, and the Tsuut'ina First Nation, as well as the Otipemisiwak Métis government.
Yeah, thank you, Kat. And I think in addition to acknowledging where we are situated today, we also wanted to just acknowledge that our work is focused on transforming cancer care with adolescents and young adults. And when we say adolescents and young adults, we're talking about those diagnosed with cancer between the ages of 15 to 39. And there are many people that have shaped this work, some who are still living and some who have died. So we acknowledge the efforts and the contributions of all of those people because all of them are inspiration in terms of creating change together. And we are here today to share about one change initiative that we've been involved in, which is the creation of this immersive theater experience that Kat just mentioned. And so I had the privilege of working together on that work. So over the course of, we're going to take a different approach to presentation, a little bit of talking, and then we have a little video, and then we'll interview each other. But over the course of 2024, there was a team of 6 facilitator researchers, 2 counselors, and 11 adolescents and young adults who worked and 11 adolescents and young adults with lived experience with cancer who worked together to create an immersive experience. And the immersive experience really tried to capture a felt sense of what it means to be a young adult navigating the cancer care system. So we worked together over the course of the year. We met monthly over 2 hours Zoom conference meetings. We had a 3-day long in-person devising session. We had an in-person workshop for 4 days. And then we had some other meetings, ad hoc, in-person and online, to really pull this immersive experience together. The end result was an immersive experience entitled Imagine. And Imagine, the name Imagine was actually from a poem that was written by a young adult, Laura, who had died, and it was really the inspiration for this work. And it was actually featured in the Imagine performance. So Imagine, it was a 40-minute performance that led audience members through 8 distinct experiences, and they were supported by a navigator or a guide. It was premiered at the BC Cancer Summit in 2024, which is an event that brings together and provides educational and professional development opportunities for oncology professionals. The team of us, so the AYAs and the facilitators, installed the set. We were the actors and the backstage support for Imagine. It ran through 3 days of the conference and was experienced by over 100 individuals. And it has played a pivotal role in building momentum and change, and actually changing and transforming the cancer care system here in BC. So to give you a sense of Imagine and what it was and what it is, I'm going to pass it over to Kat now to share a little visualization with us.
Yeah, thanks, Cheryl. So since you weren't able to be there, I'll just read off a brief summary. So I invite you to join me in this journey and imagine. Imagine knocking on a door to find yourself stepping from a conference hallway into a hospital waiting room of sorts. You're invited to sit down, handed a pen to fill out a pile of forms, and then ushered down a hallway into a dimly lit bedroom where a young adult is texting with their friends. You witness the simultaneous connection and isolation through their messages. You walk back to the waiting room where you are handed a game, a maze of cancer care system that you must physically navigate without falling through the cracks of the maze. You then witness a young mother navigating the demands of family life and cancer treatment. From there, you pivot to experience a card game entitled The Game No One Wants to Play, where an AYA must manage their limited resources as cancer progresses and come to terms with all that is lost. As you catch your breath and wipe away your tears, Navi, your navigator, leads you to a child's birthday party. While at the celebration, you realize that the everyday conversations young adults strike up are received differently by someone who's living with cancer. You then proceed back to the waiting room and take a seat. A poem implores you to imagine what it's like to be an AYA navigating cancer. Then it's time to leave, but before you do, you receive a cup of tea in your hands. Maybe write the name of an AYA who has died and reflect on the changes you'd like to see and how you can enact them. You then return to the familiar conference hallway, changed by your experiences.
Thank you, Kat, for writing that, and then also for sharing it today, because I do think it gives a bit of a visualization of what that experience was like. Imagine being at a medical conference and stepping out of the traditional sessions into something very, very different. And we did actually capture a full version of the Imagine experience on video, but we also have a highlight reel, and we wanted to share that highlight reel with you today because, again, you've just heard a little bit about it, but just to get a more of a felt sense of what that was like. And then following the video, Kat and I will then engage in a conversation about how the experience was for us. We want to acknowledge that because the experience is about young adults and cancer, and there are elements of death, some of this may be triggering for folks. So just wanting you to know that in advance, and just please do take care of yourself in whatever ways you need as you watch this video. And it's about 7 minutes long. And I'm going to pass it back to you, Kat, to make the magic happen.
Hello, welcome. Do come in, do come in. All do come in, come in. Take a seat in our lovely...
Kat, there's just a gray box above the screen. Looks like something's like overlapping the screen a little bit on your end. It might be that you just have another application that's like covering it a little bit.
Yeah.
There you go.
Is that better?
No, it's still there, but it's fine. I think let's just go with it. It's not infringing on the video at all. Yeah.
I know in my own cancer experience, when I met my oncologist, he asked me the question, who are you? Not what are your symptoms, but who are you? And that question should be asked all the time because you're not just your cancer, you're so much more than that. And I think this also is demonstrating that. It's like there's so much creativity and wisdom that young adults bring, and this brought that to light. This was a co-creation. This was not one person, this was a collective, and that's what's powerful about it.
It's been incredible actually seeing the change that's happened in the room. So immersive theatre is quite a challenging form of performance. People don't know what to expect. They can be quite challenged by it. They can feel quite resistant to it. So I've played the role of the navigator, which is the guide really, taking the people through the journey. And you can see the change that's happening in the room over the course of the performance, and then of course you hear the changes that people want to make once they leave the room, and that's really what this project is all about. The purpose of it is to make changes to the system.
The kind of idea for this was my idea, like this whole scene, because I spent a lot of time texting and Googling things at 3 in the morning, and kind of, you know, doing the deep dives onto old forums and looking for information and reading studies and, you know, seeing if anyone was up. I was on a weird time zone for all my friends, so sometimes they were. And so that was a big part of it for me. It's been so important to kind of get this message across, and I feel like it is having an impact just like here at the summit, and it'll spread farther after that, but just getting the message across that it's so different for AYAs, and that there's not a lot of resources that are kind of like in one spot. Everything's very like piecemeal, it's all over the place. So kind of having the whole experience of what it's like being an AYA through all these scenes is like one cohesive, like, this is what it's like, this isn't great, we need to fix this.
Yes, the way I think of it is I'm a clinician, and so I think what is missing a lot from our training and from, you know, lack of experience is what happens when our patients walk out of our treatment rooms and our chemo chairs, and when they leave our building, is that there's a lot of things missing that are unique to young adults that they need support for. And so I think this is a good reminder of what those things are and how that feels, and it kind of punches you in the gut, so to speak, but I think it's motivating to remember that, you know, once they leave the clinic, life goes on, and that's the part that they need support with.
It's research academia generally is a really hard place to work when you're trying to be authentic and vulnerable and live out your own values. It can be really challenging, and I think in this work it offers the opportunity to do things differently. And I think we really see that here, where, like I said, it isn't just me doing the research on someone. I'm working with AYAs, and they're telling me what to do and how we do it and how we should do it well. And there's something about that is really meaningful, being in good relation with everyone and supporting each other. This is really a collaborative effort. It isn't just about us telling people what to do or how to do it. It's about them deciding how this goes.
Walking through this experience, even in creating this experience, and just being able to highlight those areas where I've been affected has been really nice. And then knowing people are listening when they're here, and even getting to experience it in, like, I mean, it's not the same as the actual experience, but being able to step in through like the maze or seeing a card game being played or any of the shots and just being able to feel a little bit more what it feels like to be in our shoes as young adults with cancer.
And I think, like the poem that Laura Rennick wrote, how can you treat people effectively? How can we design systems effectively if we don't have an understanding of what people are actually going through as human beings? It's one thing to look at research and see the numbers and the stats on treatment, but it doesn't take into account how people come to that treatment and then how effective it is based on that. So I don't think we can treat people effectively if we don't see them as people first.
Yeah, I've been with this project from the start, and it's so hard to put into words. Such a vulnerable thing to be a part of, such a moving thing to be a part of. You really put yourself out there, and it's a big risk, but incredibly we've all created this really safe space for each other to share things that are so intimate and share our pain, and help each other heal a little bit, I think.
There's no perfect way to support a person with cancer, but I think it's also always remembering they're a person first. They are not their illness, they are a person. So to see them as a person first, be curious, seek understanding, be compassionate, and be gentle with yourself too, because there's no perfect way to do it.
It's about meeting people where they're at and supporting the AYAs through this journey, their experiences. Wherever they need to be, I'm there to support them throughout this experience.
Yeah, I definitely feel like there's change on the horizon, and in terms of how people are treated. I mean, every person, not just AYAs, every person needs to be treated like an individual. And AYAs just happen to have these very special needs that I think more awareness is coming out of this, and that's such a big piece of it, just understanding how we are different and how our experience is different. And definitely at this year's BC Cancer Summit, there's been such a big response to not just the Imagine performance, but also the other AYA-focused sessions that happened. And when you see that kind of response and you see that kind of uptake, it really gives you hope that things are going to change.
Thanks for sharing that, Kat. And we'll put the links to the videos in the chat for folks if you did want to take a look after. And you'll notice in the credits the acknowledgements of everyone who was involved in creating this. And it was actually a very big group of adolescents and adults. So I'd now just like to pass it back to you, Kat. And you mentioned a little bit in the video, but I'm curious about how was the experience of Imagine for you, and what was the value from your perspective?
Yeah. I think like first and foremost, it was really meaningful to be part of the project. And for me, not living in BC, I just feel really fortunate to have been able to come together and bring my skills that I had from before my cancer diagnosis and to be able to continue to use those in a meaningful way to help people like me, and to help inform changes for a system that's not currently serving young adults, adolescents, and young adults in the cancer care system. And it really felt meaningful being there in the room with healthcare professionals and hearing the responses and seeing the reactions to what we had built. And another thing is that was mentioned in the video is just how well supported the whole process was, making sure that there's people with experience, there's counselors to be able to work through those difficulties and make the process smoother. It is challenging coming up with something new, and especially something that deals with such vulnerable subject matter. So ensuring that we were taking care of that throughout the process was so vital to the success of this project. And just seeing the value of it was the change that it's making. We went to the BC Cancer Summit this last November, and hearing people still talking about it, hearing people how they want to change their own personal practice is really is like one small thing, and then speaking about how it can change the larger system too feels really hopeful. And then just on a personal level, the community and the connections and the relationships that it's built between me and the other people taking part is of such a high value. And even though we're like a small group of people, you can't put a price tag on friendships and relationships and connection like that. And I'll turn it back to you, Cheryl. What was the experience of Imagine for you, and what was the value of it from your perspective?
Oh, good question. Thanks for that response, Kat. I think just building from that, as a researcher and also as someone with lived experience, I would say Imagine was the highlight of my career by far. It was just so incredible. And yet over the course of putting it together, there were a lot of unknowns. It was like, how is this going to work? What's it going to look like in practice? Do we have enough funds to support counseling ongoing for folks? Do we have enough to pay patient honoraria? Like thinking about all those things behind the scenes. And then when it came to be, and just to be in the room and to feel the connections amongst all of the AYAs who are part of it, but also to witness the change in the room happening for folks was really profound. And it has really built momentum and is really shaping change here in BC. So it was an incredible initiative. It reflects in my ways some of the really creative ways that we can work together with patients to co-create change together that addresses people's needs, and not to create the change for them, but to create the change with them. And it's been just a remarkable opportunity to learn from and with people like you, Kat, because I don't have the skills to create Imagine, but together as a collective, we really created something really beautiful and special. So thank you for being part, saying yes. And I think with that, we'll pass it to the audience for questions.
Yeah. Thank you very much, Cheryl and Kat, for it's lovely to see a creative approach to research that involves so many people. At the moment, I am not seeing any questions posted either on the app or in the chat. If you would like to raise your hand if you have a question, again, I've got a question as well if nobody else does, but I welcome anybody to put just what do you need to do? Or do we not have the hand raise function? Let's see. Oh no, yeah, we do. So if you click on the React Heart button, you can raise your hand like that if you would like to ask it. Okay. Yes, Christine.
Yes, I'm actually very interested in this. I'm with the UBC Idea Lab, and we actually did a co-created virtual reality videos for people with dementia in long-term care and hospital settings. Now, I know it took a long time, so I was wondering how long it took you to create Imagine, because I think the timelines are very important, especially within the health services. Everybody wants everything quick and fast. And I was just wondering what your timelines were like.
I know, good question. It was, and correct me if I'm wrong, but it was about a year. Like we started working together, like, and connecting with the team in November, December, and then we delivered Imagine the following November. So it was almost a full year. And even that was like, there were times where it's like the night before we're like, is this going to come together in the way that we wanted to? So we probably could have used more time, but then also it was helpful to have an end date in which we had to deliver something for too, because sometimes being pressure prompted can be helpful. Yeah. It's a lot. It's time intensive, absolutely, and resource intensive. Yeah.
Honestly, that sounds pretty good for the amount of work that must have gone into it. A year is a pretty good turnaround. So well done. I see DSFU has said in the chat, what practical changes in the system that you had referred to? Could you expand on that, please? Do you have any examples or case studies you'd like to talk about changes that occurred as a result of your program?
Yeah, so I mean, I can get started. So I would say it's important to know that this work happens within the broader work of the Anew Research Collaborative, which is focused on co-creating change in collaboration with AYAs and clinicians and care providers. But over the last 4 years, we have seen, I mean, as Kat mentioned, people really changing the language of how they say things. So instead of saying, I can't imagine that, it's I can try, I'm trying to imagine that, which is like a big thing just in terms of navigating those conversations with patients. But we've also seen a counseling pilot specific for adolescents and young adults, where BC Cancer has hired counselors specific for AYAs. And then we also had an initiative focused on creating oncofertility resources and increasing awareness about having conversations around oncofertility. So we've actually engaged over 3,000 clinicians over the last 3 months, just to raise awareness of the resources and actually encourage conversations around oncofertility. And now in the process of actually, they're looking at hiring their first patient navigator in Vancouver that would be specific to adolescents and young adults. And then there also was no resource page before for adolescents and young adults at BC Cancer. So we co-created that in collaboration with patients as well. And now there's a resource page. So those are some tangible things that we've seen over the last while.
Wow. Okay, that's quite a success. Congratulations. Are there any other questions from folks? Being comfortable in silence.
we had a really good question at another presentation we gave that I wanted to bring up, and that
Sure.
was how are we able to engage so many adolescents and young adults? Because that's often an issue
Yeah.
that people face. So, and Cheryl, you had a really good answer to this last time. Do you remember?
The answer was, I don't remember. I mean, and imagine it was, it was a small group, like it was a group of 12, but we've engaged with over, I think, 200 AYAs across the province and then some beyond. But it's based on the relationships and the connections that people have. And the community continues to expand and people continue to reach out because they want to know more. And I think there is this sense of ownership that this isn't Anew, it's us as a community making changes happen. And I think that's really key. And then I think there's also the additional supports that are provided. So yes, people are, paid for their contributions and their time, but also having counseling support embedded in research projects is doesn't happen that often. And that's kind of at the core of the work that we do is we won't engage in research with patients unless we have those supports in place and people who have expertise working with adolescents and young adults. But it really is this community that is continuing to expand, and this work only happens by working together. What did I say in that session, Kat? Maybe you can add.
Yeah, no, that was great. Yeah, it's really about the relationships, and Cheryl, you've done such a good job about building trust in the research collaborations for people. So it's like we want to come back and we want to keep helping because we have trust in what's going to be delivered.
Thanks, Kat. I think that's also about being like a patient researcher. I think like having lived experience also is helpful in this context. And not necessary because we have other members of our team who don't have lived experience, but there's definitely a commitment to establishing an approach that is grounded in trust and relationality.
Wonderful.
Thank you.
Okay, we're
thank you,
coming
Kat.
off of the last question, maybe. But unless anybody else has one that they want to jump in, I have one I do want to ask is, so immersive theater, that's an interesting way to go. I mean, obviously, I don't, maybe as researchers, we don't often work with our creative selves as much. So I'm just curious about your journey to how you decided that immersive theater would be the best way to do this. And what about it do you think was so effective? Because it seems to.
So the how it came to be is we ended up with a New Frontiers in Research grant, which actually brings together two disparate disciplines. So we were looking at the health sciences and then theater. So that's why and how the grant came to be, because we were successful. But I think in terms of effectiveness, I'm going to pass it over to you, Kat. Why do you think it might have been effective? And then I have some other thoughts, but what do you think?
Yeah, I've long been interested in like the arts and creativity in STEM fields, and this immersive performance really showed the value of bringing creativity into it. There was such a deep empathy that people were able to, like the conference attendees were able to come in and experience it in a different way, experience what AYAs go through in a different way than in the medical and healthcare environment. So I think that creativity helps to bring a little bit more empathy into it. And like for AYAs, for us as like co-researchers too, it's quite accessible and therapeutic. Like it's a nice way to be able to express what's going on without needing a university degree necessarily to be able to communicate our needs and our experiences.
And the power of storytelling. I mean, I think that's inherent in the approach too. And it wasn't necessarily delivered in like a testimonial way, like this is my experience, this is my story, but it's like what are the key aspects of the young adult experience that we want to share, and how do we share those in creative ways? And I mean, Alana talked about it like being a gut punch in many ways. It was this awakening. It was like, oh, this is what people are experiencing. Oh, like it was pretty powerful. And And to have it at a conference where it was a traditional medical conference, it also was, there was something about that that I think made it successful too. People were stepping into a very different space and they were open to it. Yeah.
Wonderful.
Excellent. Thank you. Thank you.
Yeah, thank you very much again to all of the presenters and for the attendees for joining us. Hope you enjoyed it and have a great rest of the conference. Thanks very much.
Thank
Take
you.
care.